Recently, I recommended HBO Rome to a friend. After he watched the second episode, he asked me if the depiction of the medical operation was historically accurate. I only knew that the skull trepanation had been performed in a lot of ancient cultures, but wasn't aware about the state of it in the late Roman Republic. So I decided to research it to every minute detail and make a video about it, and I hope you enjoy it. Trepanation of the skull is the earliest recorded surgical procedure in human history. Archaeologists have found evidence of successful operations dating back to the Neolithic age. In ancient times, flints and shells were used to open the skull. The operation was carried out either for medical reasons, as a mystical practice, or as a combination of both. The notion of such a procedure being performed in the late Roman Republic isn't controversial, but the way it was carried out certainly changed throughout history. So we are going to analyze the circumstances and the details of the scene, and determine how closely the portrayal corresponds to the state of medical practice in the late Roman Republic. The scene starts after one of the show's protagonists, Titus Tullo, gets in a tavern brawl and is struck on the head. He rushes to the house of his senior officer, Vorenus. The man of the house sees the severe head trauma and immediately calls for a doctor. So far, everything checks out. Vorenus is an experienced soldier who would be able to recognize that the injury requires immediate medical attention, and in a megapolis as big as Rome, a professional was easy to find. Roman medicine was significantly influenced by classical Greece. Ancient Italians were generally skeptical of medics and preferred to rely on traditional remedies, rather than seeking professional help.
Women's troubles. Nothing a good leeching won't cure.
Doctors were only summoned in critical situations, like the one depicted in the show. Classical Greece was another matter. It had a centuries-old tradition of medical studies going back to the works of the legendary physician Hippocrates, and the Greeks spread their knowledge and experience across all of the Mediterranean. Republican Rome didn't have hospitals, but medical help was readily available from private practitioners. Skilled medics came to Rome from Greece, both as slaves and as free men planning to make it big in the Eternal City. In the next scene, we see Titus Tullo strapped to the table and the medic performing an operation on his head. This whole sequence draws heavily on the writings of Hippocrates and his later Roman disciple Aulus Cornelius Celsus, or Celsus. As early as 400 BC, Hippocrates recommended trepanation for these types of wounds in his work on head injuries. Cases of fracture of the skull. If the bone isn't broken or split, there is no danger, and this patient should be treated by moistening drugs. But if it is broken and there is a fissure fracture, it is dangerous. You should trepine this case to prevent pus from flowing through the fracture of the bone and infecting the membrane. For since in this narrow place it can get in but not out, it causes distress and madness. First, we see that the patient wasn't given any form of anesthesia. This is in line with medical practices of the time. Celsus does mention opioids in his writings, but recommends the surgeon to simply make his operation quick and ignore the patient's cries of pain. The incisions that the surgeon makes are pretty standard. You can find instructions for them in either Hippocratic corpus or in later classical surgery manuals. The interesting part are the instruments, especially the cylindrical saw that you see on the screen. This instrument is sometimes called the crown saw or the trephine. Its Latin name was modiolus. Modern archaeologists have found a lot of these instruments and their illustrations. The trephine presented in the show even has a bowstring mechanism that helps with the rotation. It is similar to the bone drill that's been used to produce fire since ancient times. While I couldn't find the artifact evidence of a bowstring trephine, it is famously described in Celsus's book De Medicina, on medicine. Celsus is also credited with improving the instrument by adding a central pin to prevent slipping. This modification is not depicted in this scene, but this omission is understandable, given that Celsus wrote half a century after the events of the show. Overall, the portrayal of trepanation itself is very historically accurate. We then see the surgeon removing a bone fragment from Tullo's brain with bronze tweezers. The patient's membrane, or dura, appears to be damaged. These types of injuries were known to be very dangerous. Hippocrates estimates the chances of survival to be significantly lower in these cases. On the next scene, however, I have some questions for the show's writers. The surgeon performs cranioplasty, the repair of the skull with the metal membrane. While there is a famous skull from ancient Peru that had healed after being repaired with gold inlay, such operations aren't known to have happened in classical Greece or Rome. The The choice of metal is also questionable. It certainly is not gold or platinum, which are the go-to metals in modern cranioplasty. Judging from its color and plasticity, I think it is supposed to be tin, but in the list of metals historically used for cranioplasty, I couldn't find mentions of tin. It may also be aluminium or silver, which is somewhat plausible, but applying it on a damaged brain that hasn't yet healed would invite infection or at least a strong allergic reaction of the tissue. Classical physicians recommend reassembling the damaged section of the skull, using specially prepared plasters soaked in vinegar. After the operation, Tullo lies in bed and his head is elevated. Good to see the characters of the show following the post-operational instructions to the letter. Celsus recommends that the patient be kept with a relaxed neck and lifted head, in a well-ventilated space and avoid sneezing. Even the final instructions from the surgeon are written with historical accuracy. Note that he speaks with an accent, indicating that he is supposed to be Greek.
There will be copious pus, first putrid, then wholesome, and mayhap fits of the spleen, but that will be all to the good. A purging of the malignancy will follow. This is brass.
The part about the pus reflects the medical attitudes of the time. Classical doctors often considered pus to be an indicator of healing. Later Greco-Roman physician Aelius Claudius Galenus, or Galen, was even criticized for stymieing the medical progress by popularizing the idea of laudable pus. Galen was absolved of this reputation only by recent scholarships. His teachings on the matter of separation are now agreed to have been misunderstood. The confusion probably arose from Galen's advice on abscesses, a condition where he did think it was important to see pus, since the lack of drainage could prove fatal. The final words of the surgeon are also true to the nature of the situation.
When will he wake up?
Today, tomorrow, maybe never.
While the survival rate of the operation was quite impressive for the time, the puncture in the membrane made it much more dangerous. The show's character, Titus Tullo, is certainly a man beloved by the gods, considering his survival and speedy recovery.
You might try an offering to space. A white rabbit often works. I'll send my boy tomorrow to check the dressings.
Can't really comment on that last bit of advice. Spes was the Roman goddess of hope, and the city had her temple on the Quirinal Hill, but I couldn't find much information on the effectiveness of white rabbit offerings for the success of skull trepanation. If I had to rate the scene on historical accuracy, I'd give it an 8.5 out of 10 rating. They do get almost every detail right, except for the part with the metal implant. The main procedure follows the established practices of the time, and even small details, like post-operational treatment, aren't forgotten. It's pretty incredible how the show's writers managed to weave these small aspects of everyday life in the Roman Republic into the narrative, while making so few mistakes. I'll put my list of sources in the description, so you can check them yourselves. If you have any questions on the topic, feel free to ask them in the comments. Thanks a lot for watching till the end, and I will see you in the next one.